We'll go ahead and get started. Thank you all again for joining us today. We're very grateful to have Asim Dietrich here to speak with us regarding best practices for representing clients with diminished capacity. And this one qualifies for ethics credit. Just a little housekeeping before I turn it over to our moderator for today, Scott Greaves, who's one of ACBC's devoted members and also the chair of the CLE presentation. If you would please make sure that your name and not your telephone number is on your Zoom sign in, and that's for our CLE credit purposes. So if you're looking to get CLE credit for today, please make sure that your name, not your phone number or anything else, is on your Zoom sign in. So that's what we're seeing as your with your video here. The CLE session is being recorded for members' future viewing, so we do ask that you please keep your microphones muted during the presentation, and please type any questions that you have during the presentation into that Zoom chat box so we don't interrupt the presentation. Scott and Asim are going to do their best to monitor that chat, and they may try to work your questions into the presentation. But if not, we'll save room at the end for Q&A session, and we'll take the questions out of the Zoom, but you'll also be welcome to unmute yourself at that point and ask any questions that you may have lingering at the end of the presentation. The materials for today's session have been posted to ACBC's website as always, and they've also been placed here in the chat function on Zoom. We'll place them there again shortly for those of you who have just joined us. If you're not able to see the PDFs in that Zoom chat box, if you would please let us know either by putting your email address in the Zoom chat or sending us an email to admin@acbcforum.org, and we'll send those PDFs to you by email. The CLE certificate for today's session will be posted in the Zoom chat as well. So it is important that you're able to see the PDFs in the Zoom and that you do grab that CLE certificate when we post it. We will make a verbal comment when the CLE certificate is posted to the chat at the end of today's session. So again, you want to make sure you grab that certificate before we close out the Zoom because that's the last time you'll have access to it. And with that, I will say thank you to Asim and Dietrich and also to Scott. And Scott, I'll turn it over to you.
Thank you, Crystal. Hold on one second. My phone is ringing. Sorry about that. My name is Scott Greaves. I'm with the law firm of Greeves and Rothler, where we practice in the area of consumer bankruptcy and settlement of tax debts. I'm happy to introduce our presenter today, Asim Dietrich. He's the supervisory attorney for investigations, monitoring, and accountability with the organization Disability Rights Arizona, formerly known as the Arizona Center for Disability Law. Asim advocates for the legal rights of individuals with various disabilities. His work includes the representation of individuals who have experienced abuse, neglect, and discrimination due to their disabilities, and individuals who have been denied medical and mental health care services. Disability Rights Arizona is a nonprofit public interest law firm dedicated to protecting the rights of individuals with a wide range of physical, mental, psychiatric, sensory, and cognitive disabilities. Today's program will discuss the ethical rules related to representing clients with diminished capacity and provide you with strategies to address ethical concerns when representing those clients. This program will also inform you about the requirements under the Americans with Disabilities Act, the ADA, to provide reasonable accommodations to clients who have disabilities. You will also learn practical tips to ensure that clients receive effective accommodations throughout the representation. If you have any questions during the program, please post them in the chat area. Asim will address your questions as we go. So hopefully this can be a conversational presentation as opposed to a lecture. At the end of your hour, microphones can be turned on and Asim will be happy to take any questions. So without anything further, Asim, please take it away.
Okay, thank you, Scott, for that introduction. Good afternoon, everyone. So as Scott mentioned, I'm a supervisory attorney at Disability Rights Arizona, or DRAZ. It used to be known as Arizona Center for Disability Law. So just some information before we get started about who DRAZ is and the kind of work that we do. So we're Arizona's designated protection advocacy organization for people with disabilities. So we're a nonprofit law firm that assists Arizonans with disabilities to promote and protect their legal rights to independence, justice, and equality. And DRAZ envisions a society where people with disabilities enjoy full acceptance without barriers. And so, as a protection advocacy organization, we're part of a nationwide network in every state and territory, various disability rights and protection advocacy organizations. So there's an organization like ours in every state and territory. And just information about what we do. So we advocate for the rights of people with disabilities to be free from abuse, neglect, and discrimination. And we do that by providing information to individuals with disabilities, providing technical assistance, which is basically providing rights information, providing referrals to assist people with disabilities in self-advocacy. And we also represent individuals with disabilities regarding their disability-related legal issues. So today's learning objectives, first we're going to have a discussion about the ethical rules related to representing clients with diminished capacity, and then the basic requirements of Title III of the ADA, reasonable modifications under Title III of the ADA, and some strategies to accommodate clients with diminished capacity. So the ethical rules and the ADA kind of go hand in hand to make sure that clients with diminished capacity both receive ethical representation and also receive the accommodations that they need. So I'll start with discussing ethical rule 1.2, which has to do with the allocation of authority. So the lawyer is required to abide by the client's decision concerning the objectives of the representation. Lawyers are also required to consult with clients regarding the means by which the objectives are pursued. And they may take action on behalf of the client that is impliedly authorized to carry out the representation. So if there's an implied authorization for a lawyer to take certain action, they can do that as part of the representation. And then the lawyer must abide by the client's decision whether to settle a matter. So we'll go over how that translates to representing clients with diminished capacity in a couple of slides. But then I also wanted to mention ethical rule 1.4 related to communication. So the lawyer is required to inform the client of any decision or circumstance when the client's informed consent is required, and reasonably consult with the client about how the client's objectives are to be accomplished. So the client also has to be kept reasonably informed about the status of their matter, and the attorney has to promptly respond to clients' reasonable requests for information. And lastly, the lawyer must explain a matter to the extent reasonably necessary to allow the client to make informed decisions. So that's another requirement that might be a little different when you're representing a client with a disability, or someone who has limited capacity. So now I'll just go over the rule related to clients with limited capacity. So you'll find that information in ethical rule 1.14. So first, the lawyer is required to maintain a typical attorney-client relationship with the client as far as reasonably possible. So that requirement kind of also dovetails with the ADA requirement to not discriminate against people based on their disability, and also to make sure they receive the reasonable modifications they might need. So the intention from both the ethical rule and the ADA are to make sure that people with disabilities are treated like everyone else and do not experience discrimination. And then information related to the representation of a client with limited capacity is protected by attorney confidentiality rules in ethical rule 1.6. So attorney-client confidentiality does not change because the client may have limited capacity. And just some more information. So the lawyer cannot may take reasonable, necessary protective action for a client with limited capacity, but that could only be done if the client is at risk of substantial physical, financial, or other harm unless action is taken. So they have to be at risk of substantial harm before protective action can be taken. Also, the client also has to be unable to adequately act in their own interest. And the protective action that can be taken includes consulting entities that have the ability to protect the client, or seeking the appointment of a guardian ad litem, conservator, or guardian. So the protective action that can be taken limits the client's rights. That's why it's so important that the protective action only be taken if the client is at risk of substantial harm and cannot act in their own interest. And then just some of the comments regarding ethical rule 1.14. So a client with limited capacity often does have an ability to understand, deliberate upon, and reach conclusions about matters affecting the client's own well-being. It's just a matter of explaining the situation properly so the client can fully understand and make an informed decision. And the fact that a client suffers a disability does not diminish the lawyer's obligation to treat the client with attention and respect. And I think that's another comment that really goes together with the ADA, with the intention of the ADA, as far as making sure that people with disabilities do not suffer discrimination and are treated with the same respect as people without disabilities. And the lawyer should also treat clients with limited capacity like typical clients, particularly in maintaining communication. So that level of communication and providing the client information should be the same, whether they have limited capacity or not. And that includes even for clients who already have a legal representative like a guardian. Even if someone has a guardian, the individual is still the client. And so again, even if the client has family members or others such as guardians that participate in discussions with the lawyer is required to look to the client to make decisions on the client's behalf. So very often what happens with people with disabilities, whether they're obtaining legal services, medical services, other kinds of services, the person providing the services will often look to the person with disabilities, family member, or other individual rather than speaking directly to the person with a disability. So even if someone has a disability, the best practice is to speak to the person you're representing and make sure they understand the situation and what their options might be. So again, if there's any questions on that or anything else, feel free to put it in the chat and I can answer those questions. So we went over the ethical rules related to clients with diminished or limited capacity. And now I'm just going to go over some of the requirements under the ADA and how those might fit with the ethical rules. So first of all, the definition of a disability under the ADA, it's a very broad and expansive definition. So there is one question stating if there's a guardian who has the final decision authority of the client or the guardian. So if there is a guardian, the client who's under guardianship, if that's your client, they have the final decision authority. So even if your client has a guardian, they're the client, and they make the final decision on how to resolve a case. If the guardian, you have the ability to speak to the guardian without violating attorney-client confidentiality. But again, the final decision authority should rest with the client. So the definition of a disability under the ADA, it's any physical or mental impairment that substantially limits one or more major life activities. So again, it's a very broad definition. The definition also includes a record of such an impairment or being regarded as having such an impairment. So that third part of the definition does not apply when requesting reasonable accommodation in employment, but it applies in other situations under the ADA. And then I have a citation there if you would like to review the definition. So major life activities, these are just some examples. They might include things like seeing, hearing, communicating, speaking, lifting, walking. For people with limited capacity, include things like thinking. Could also be relationship with others. Those could all be major life activities. And then it also includes operations of major bodily functions. So neurological function, brain function, immune system, circulatory system, respiratory system. So impairments in any of those bodily functions. But again, it's not an exclusive list. It really could be any major bodily function or life activity. And then just a word on invisible disabilities. So any mental or psychological disorder such as an intellectual disability, emotional or mental illness, and learning disability. Those are all disabilities under the ADA definition because they're mental impairments. And then again, a diagnosis is a disability if it substantially impairs the ability for a person to perform a major life activity. And that's in comparison to the general, to most people in the general population. So if it's if the major life activity is substantially impaired compared to people without the disability or the diagnosis, then it's a disability under the ADA. And then the Title III of the ADA requires, and that's the title of the ADA that would apply to most law firms. If you're a sole practitioner or you work for a private law firm, your work would be covered under Title III of the ADA. And then Title II would apply to attorneys who work for government agencies. For example, prosecutors. A prosecutor's office would be covered under Title II. But I think for our purposes, Title III is really what is the controlling part of the ADA. So that it requires that no person with a disability can be discriminated against because of their disability by anyone who owns, leases, or runs a place of public accommodation in the full and equal enjoyment of the goods, services, and programs of any place of public accommodation. And then examples of places of public accommodation, again, it's not an exclusive list. Professional office of a healthcare provider, a hospital, or other service establishment, a service establishment, including the office of a lawyer or accountant. So law offices and law firms are places of public accommodation. Place serving food or drink, a place of exhibition or entertainment, and any retail establishment. So basically any privately owned business that provides services to the public. So discrimination under Title III of the ADA encompasses a few different things. So discrimination could be denial of participation or benefit from the goods, services, or programs offered to the general public. Denial of equal participation in or benefit from goods, services that are provided. So even if the participation or benefit is unequal, that's considered discrimination. Providing goods and services to a person with disability that are separate from or not equal to the goods and services provided to people without disabilities, and the failure to provide goods and services to people with disabilities in the most integrated setting possible. So one of the main goals of the ADA is to make sure that people with disabilities are integrated into their community. So that requirement's very important, that services be provided in the most integrated setting possible. And then it's also discriminatory to impose eligibility criteria that tend to screen out people with disabilities from the full and equal enjoyment of anything a public accommodation offers to people without disabilities. So even if there's no bar on serving people with disabilities, if it's some other type of policy or procedure, one example can be um, a prohibition on animals being brought into an office without an exception for service animals. So if there's a no animal policy and there's no exceptions made for service animals, that's not a policy that is saying no people with disabilities, but it is screening out certain people with disabilities who have service animals. And then the failure to remove architectural barriers and communication barriers that are structural in nature in existing facilities, and the failure to make new facilities accessible to persons with disabilities. That's also discrimination. So there's often a myth that goes around that a building that was in existence before 1990, before passage of the ADA, does not need to be accessible. And that last slide is meant to dispel that myth. So even if a building is pre-1990, it has to be made accessible. Barriers have to be removed to allow a person with a disability access. And there's also there's no exception for historical buildings. I've heard that out in the community too, but that's actually a myth. Some barriers have to be removed even for buildings that existed prior to the passage of the ADA. And then now I'm going to move to discuss specifically reasonable accommodations. Again, if there's any questions, feel free to post them in the chat. So discrimination also includes the failure to make reasonable modifications in policies, practices, or procedures to afford people with disabilities full and equal enjoyment of anything the public accommodation offers to other people. So we use the term reasonable accommodations and reasonable modifications pretty interchangeably, but the requirement is to make sure the policies, practices, and procedures are modified to provide access and the full and equal enjoyment for people with disabilities. And then there's also a requirement to provide auxiliary aids and services when it's necessary to allow people with disabilities to fully and equally enjoy the services of the public accommodation. So examples are large print materials, braille materials, sign language interpreters, augmentative communication. Those are all examples. So just some ideas and examples for accommodations for clients with diminished or limited capacity. So if someone has diminished capacity, it's important to provide information to the client in simplified language. So it's very important we don't use too many legal terms of art, and make sure that we properly explain any legal information in the simplest way possible. It's also important to inform the client about the positive and negative consequences of each choice. So, in making sure that we don't just give the client their choices on what their options might be, but explain each option in simplified language and then really go through the pros and cons of each of their different choices or options. And then make sure the person fully understands each choice that may be presented to them. So, double check with them, check in with them. When you explain something, go back and say, okay, do you understand what I just explained? And if you feel like it's important for your client to repeat it back to you, just to make sure they understand, that might be an accommodation you need to make just to make sure the client understands what you're telling them. And then always important to listen to the client and encourage the client to make their own decision. And it might take extra time. It might take extra explanation, but it's always important as that, the client has that final decision authority. And it's always important that you're not making that decision for the client. And then person-centered planning is something also that can assist with individuals with limited capacity. It's used a lot in the medical context, but I think it's also a good strategy in the legal context when attorneys are representing clients. So it's really a discussion with the individual and a way to find out what is important to the person, where the person is and where they want to be. So what is their current situation? What are their goals or objectives? And what needs to change and what needs to stay the same? So basically what can be done to achieve the person's goals or objectives. And so having a discussion about what's working and what isn't. And then the services are driven by the person and may include people chosen by the person. So I think those are all important principles when representing clients with disabilities. And then supported decision-making is another strategy that can be used. And it's basically the essence of person-centered planning. But supported decision-making is when people with disabilities use trusted friends and family members or other people they trust to get the help they need to understand the situations they face so they can make their own decisions. So I think that can apply to attorneys representing someone with a disability and assisting them to fully understand what the situation is, and then helping them to fully understand what their choices are and making a decision. Okay, and then I just want to go over some ideas for accommodations for people with various disabilities that you may encounter in your work. So accommodations for psychiatric or mental health disabilities could be service animals assist many people with many different types of psychiatric disabilities with a lot of different coping mechanisms. So again, even if you can't see the person's disability, that service animal may be necessary for a psychiatric or mental health disability that's invisible, that's not visible to just seeing the person. Behavior modification techniques can be an accommodation. Reminders about things. So you may have to also, when providing information to a client, you may have to repeat yourself multiple times. They may forget what you're asking due to their disability or what you're telling them. And you might have to remind them about conversations you've had in the past due to their disability. And then modifying the way things are explained. So again, explaining things in simplified language, not using too many legal terms of art or terminology that might be difficult to understand. Redirection, that's I think very important, especially for people with mental health disabilities, because sometimes everything is coming at someone all at once, and it's difficult to filter things out, filter out different stimuli when you have psychiatric disability. So your client may go on various tangents and bring in a whole bunch of unrelated issues due to their disability. So redirection is always important to keep that client focused on the issue at hand, on the issue that you're helping them with. And then having a behavior response plan. Sometimes clients can be aggressive due to a mental health or intellectual disability. So having a behavior response plan or something like a communication plan can help accommodate some of the more aggressive clients who may be aggressive due to disability. So you might need to, come up with a plan to respond to their behaviors. And then being more understanding of behaviors related to mental illness. It's important to understand, and I know this from my work often, you'll encounter people with a mental health disability that have some inappropriate behaviors. And it's important to be more understanding of those behaviors and discuss with the client how you can accommodate some of those inappropriate behaviors and still provide effective representation.
We've got a question in the chat there, Asim. What types of behavior modification techniques might be used? Is there a place where attorneys can find examples of these accommodations?
Yeah, there are several resources to find examples of accommodations. What I can do is I can forward the various resources. I don't have them off the top of my head, but I can forward some resources to Scott. Scott, if you would be able to send them out to the group, I can forward them to you.
Sure. I was thinking, what else can an attorney do to know what issues a client is facing? Should the attorney ask the person? A lot of this might not be readily apparent to a lawyer.
Yeah, so I don't think you can ask a client about their disabilities. I think that would most likely violate the ADA. But I think if you're just seeing some behavior or you've experienced some interactions where the individual may not be speaking to you appropriately or may not, may have erratic behavior that is not typical. I think discussing with them and seeing if there are any accommodations that can be provided. Because it is often when you see certain behavior that might be inappropriate, it is often an a psychiatric disability, and an individual may not be open to sharing that. So, again, the requirement is to provide reasonable modifications. So if it causes an undue financial hardship or fundamentally alters the service you're providing, then there's still, in those situations, you don't necessarily need to provide the accommodation. So if you're going from being an attorney on, legal representation to having to be a medical professional and diagnose someone, it's not necessary for you to go that far, because now that's fundamentally altering what your job is, what you've been hired to do. So I would say just have a discussion with someone and find out if you can accommodate them. If there are certain accommodations that can be implemented to help with those interactions and helping to make sure that your interactions are more positive.
It looks like we got another question over here. I'll summarize it. If you're representing a client who has a POA assisting them, and you think perhaps the POA or guardian is abusing the person, at what point can you report that to Adult Protective Services, or is there any obligation for you to report it to Adult Protective Services?
So, there actually is an obligation for attorneys under the enabling statute for Adult Protective Services. There is an obligation that if you're an attorney and suspect that your client may be suffering either abuse, neglect, or financial exploitation, there's a requirement that be reported to APS. And I don't think it would necessarily violate attorney-client confidentiality, because that exemption is also under the ethical rules. That if you suspect that the client is going to suffer some type of substantial harm, that can be reported to agencies that might be able to help. So yeah, I do think that if you believe your client is being abused, neglected, or exploited, I think there is a requirement to report that to APS, even while, even during your representation.
Is there any requirement for the attorney to withdraw at that point?
No, I haven't seen a requirement for the attorney to withdraw, because again, the individual is your client. You're not representing the POA. You're representing the interests of your client. So yeah, I mean, there's really no conflict there. The requirement is that you represent the interests of your client, whether or not they have a attorney or guardian or any other representative, because you may also need to protect your client from that individual, because often it's the power of attorney or the guardian that is financially exploiting them. So your client may need protection from that individual. And I think that, again, the client is who you're representing. So I don't think it presents a conflict where you have to withdraw. And then accommodations for people who are deaf or hard of hearing. So those individuals may also use service animals, American Sign Language interpreters, for those whose primary language is ASL. It's always best to get an in-person interpreter. Speech to text software can be helpful, but again, it's important to remember if someone's primary mode of communication is ASL, American Sign Language, that's a completely different language than English. So it's not English. It's a totally different language. So if that's their preferred mode of communication, it's really important to get an interpreter, because people whose primary language is ASL are not fluent in written English, and they're going to miss a lot of things if you're using written notes instead of an interpreter. Also important to remember to always get a certified legal interpreter when you have a client who's deaf or hard of hearing. And then the ability to communicate via text message or email. Again, this is for individuals who are proficient in written language, in written English. Video phones can be used as well. And basically a lot of people who are deaf or hard of hearing already have video phones. So if you just call their phone number, their home phone number, that's a good way to communicate as well. But again, it's important that you're getting a legal interpreter. So even if you call your video phone, you can request that they provide a legal interpreter. And then amplification systems for people who are hard of hearing may also be helpful.
You mentioned earlier, Asim, that we should not ask people about their disabilities. Is it okay to ask someone what the best method is to communicate?
Yes, if they've informed you of their disability or informed you that they need accommodations, yeah, I think at that point it is, I think it's actually best practice to make sure that you do ask, because with people, especially when you're dealing with effective communication, you want to make sure that you use the preferred method of the individual who needs the accommodation. So yeah, it's always important to ask what method of communication would be preferred for them and would be most effective. And then people who are blind or low vision, some accommodations, service animals are helpful for them as well. Providing print information in large print, braille, or electronic formats. And I think what you can do there is you can make that a practice for all your clients, asking them if they need materials in alternate formats. Do they need large print or electronic? And if someone does inform you they're blind, find out if they would need braille. But like providing large print, I think that's helpful for a client, might be helpful for clients who don't even have disabilities, just having that option available. And then screen reader software. So you as an attorney wouldn't provide that, but you would have an obligation to make sure your website is compatible and accessible to screen reader software. And make sure that any documents you might send electronically would be compatible with screen readers. And there are a lot of resources online to make sure that your website is accessible and that your documents are accessible. And then magnification software, again, just making sure that your materials and your website would be able to work with that type of software. And then portable note takers. So if you want to leave notes for a client, that might be a helpful way to do it. I think that most of the time that might not be needed. That was included as an example before we had things like email and text. So you might not use that accommodation too often. And the accommodations for people with speech disabilities, and this could go hand in hand when you do have a client with limited capacity or an intellectual disability. Sometimes speech disabilities go along with that. So it's the most important thing I would say is not to pretend you understand someone. If you didn't understand what someone just told you, ask them in a polite way to repeat themselves. Say, I didn't quite understand what you just said. Would you mind just repeating it maybe a little more slowly, because I want to make sure I understand what you said. And that's perfectly accessible. Someone with a speech disability would often prefer you ask them to repeat themselves, so they know that they're being heard. And then if speaking is just not working, see if writing notes back and forth would work, or even texting each other, emailing each other. See if those different options might be helpful. Some individuals use augmentative communication devices, which is basically a computer that speaks for them. They have different buttons and options they can push, and then the computer will actually speak. So if you encounter a person with such a device, it's important to continue to have a normal conversation. While accommodating any issues with limited capacity, you may still have to have a simplified conversation, but it's best to make sure that it's still a normal conversation, even if someone's using a communication device. And then very important, and I think this is just good advice for life. It's not even related to disability. Do not finish thoughts or sentences for someone. I think as attorneys and people, that's just a good thing to always remember. Let someone complete their thought, because often when you're assisting, you may think you're helping by completing someone's thought, but they might be trying to say something completely different, and then they're going to feel like they're not being heard. And then patience, again, I think is always important. Communications with a client with disabilities may take longer. You may need to set a longer time for your meeting with a client with a disability. But it's important to give them that time, and just to be patient and make sure that they're being heard. Okay, so just some resources, and these links are in the PowerPoint, so when you receive the slides, you'll be able to click on these links. So the Department of Justice has an ADA primer for small businesses. So if you're a part of a small firm or a solo practitioner running your own firm, you know, that might be helpful because it's geared towards small businesses. And then the IRS has guidance on tax benefits for making businesses accessible. So I believe it's up to a $15,000 a year deduction that businesses can get for any expenses related to accessibility. So you know, that guidance is important, I think, when looking at any tax benefits. And then there's also the Department of Justice also has a complete listing of Title III technical assistance materials. So they have materials related to all different types of businesses, rather than just having to go through the statute and the regulations. These materials can provide some helpful examples on how to make sure that you're in compliance. And then the website for our organization for DRAZ, it's azdisabilitylaw.org. So we have a lot of technical assistance materials as well that may be helpful.
That's great, Asim. Thanks a bunch for all that excellent information. We're right at 1 o'clock right now, so really good timing. Do you have time to answer a few questions if people have questions, Asim?
Yes, you can open it up to questions.
Okay, if anybody's got any questions at this point, feel free to open up your microphone and ask away.
Asim, this is Diane Drain. On that last slide where you had the internal link or the links to your materials, that's not going to come across to the our attendees. Could you possibly send Scott those links, and we'll make sure to provide those on the materials at the ACBC website.
Sorry. Yes, I can send those links to Scott.
Thank you.
I had to step away for a moment, Scott, but I did see a couple of questions in the chat. I heard you work one of them into the presentation. Are there any others in the chat that we can grab?
I think we got everything.
Okay,
Was
awesome.
anybody in the chat that didn't get their question fully answered?
And you're welcome to unmute yourself and speak up if you want. I did post the CLE certificate. Well, I got the mic for a second. I posted the CLE certificate in the chat, so you should be able to see that PDF. And Karen, I'll email it over to you in just a minute.
I think one thing that comes up often, Asim, is physical accessibility to an office. Maybe you can talk for a minute about any requirements for automatic door openers. Is it adequate if a law office has a reception person that's sitting there watching the door? If people can't get in, does that meet the requirements of the ADA? What if you're renting an office in a building that doesn't have a door opener, but is it up to the landlord to install something like that?
So a door opener is not required by the ADA. I think it's always a best practice to have one available. You know, if it's something that you're able to do. But the ADA has accessible design standards. And Scott, I can send the link to that, to you as well. So basically, it's an appendix to the ADA regulations, and it has a specific design standards to ensure physical accessibility. So there are requirements about how difficult it can be to open a door. If you have a very heavy door, or like a door with a spring where you pull it open, but as soon as you let go, it just closes very quickly. Something like that would probably need to be modified. But you can consult accessible design standards, and uh, there are also individuals, ADA experts, who work as accessibility consultants. They can also be a good resource to make sure that you're complying with all the requirements related to physical accessibility. And then the question about if you're leasing an office, so the ADA requirements apply to contractual arrangements. So even if you have a lease agreement with someone to rent an office space, you're still required to comply with the ADA. So basically, the person leasing you the office is required to comply with the ADA, and so are you as the business owner. So it's obligation on both parties to make sure that things are accessible. So if the landlord is not making sure the building's in compliance, then it would be your responsibility to make sure that people can access your office. And then basically, you can fight with your landlord to be reimbursed if any improvements were their responsibility.
Does anybody else have any other questions? Okay, seeing none, I'll say thanks again to Asim for that presentation, a lot of great information. Crystal, I'll turn it back over to you. Let us know how we can get our CLE certificate and any other things we need to know at this point.
Yep, your CLE certificate has been posted here in the Zoom chat. I'll put it there one more time just for your ease. Please do grab that certificate from the Zoom chat if you haven't already. That is the only place you're going to see or have access to it. One second, I'll get it posted there again. It's just a few comments up if you can see it. ACBC has lots of member-only events that our members are always welcome to attend. I know we have some non-members here, so I hate to make these plugs, but we do have our member-only happy hour every third Wednesday. So that's going to be next Wednesday, the 21st at 5 p.m., also on Zoom. So we encourage you to join that. And every Thursday, of course, ACBC members can attend Think Tank at 4 p.m., also on Zoom. These and all kinds of other amazing events are on the ACBC calendar. We encourage you to check out the calendar online anytime. If you have any questions, let us know. Your CLA certificate is in the Zoom chat, so grab it before it's gone. Diane, any final comments?
No,
Thank you so. Thank you. Yep.
Thank you very, very, very much for doing this. I greatly appreciate it, and it is so important that we really stop and think about what we're doing. As far as our websites, our access to our building and whatever else it might be. And COVID has brought in a whole nother set of questions for those operating out of your own home, who might be seeing people, or whatever your platform is. So Asim, thank you very much. Scott, thank you for the idea of inviting Asim. We highly appreciate that. So everyone take care.
Thank you all.
Thank you.
Bye.